webinar is going to be on acupuncture for the treatment of infertility. And we have Don Charlson here from Family Chiropractic Associates of Scarborough. And he has treated many women that have had infertility issues in the past, and he's got a lot of experience with it. So he's going to share some information with us today, and take it away, Don.
Thank you, Kim. Hello, everyone. My name is Don Charlson. I'm a registered nurse and licensed acupuncturist. I work at Scarborough Family Chiropractic Associates. I've been with the group about 3 years. However, I have been in practice for over 20. I treated my first patient for infertility 20 years ago, and it was a really good experience. She did well, became pregnant, treated her for a number of things, including kidney stones, and her child is actually almost of legal drinking age now. Anyways, this next slide shows where I studied in China. I have a Master's of Science in Oriental Medicine. This is in Beijing. I was over there in 1998. I am nationally board certified in acupuncture by the National Commission Certification Commission for Acupuncture and Oriental Medicine. Acupuncture has a rich history. Acupuncture is the oldest continually practiced form of medicine in the world. Infertility has been treated for over 2,000 years. And in fact, the framework for treating infertility was first written about in 221 BC. 800 years later, there was a recognition of a variety of reasons that contribute to infertility, and also the importance of early pregnancy support and positive reinforcements to patients undergoing treatment. The treatment had continued to evolve. In 1200 CE, it was recognized the importance of regulating menses in treating patients for infertility was recognized. During the late 1600s, it was also acknowledged that there are the possibility of physiological defects that could contribute to sterility or infertility, and also the importance of advocating for gender-specific lifestyle advice. Infertility itself is a loaded term. Couples who seek treatment, they usually do so after experiencing a lot of frustration. Technically, it's defined as the inability to conceive for at least 1 year of regular unprotected sex. It's important that we remember both as a society and then people either receiving treatment or treating people, that infertility or subfertility is not inconvenience. It's a disease of the reproductive system that affects the body's ability to reproduce. When you think of infertility, many people think that people aren't able to have children at all. In reality, it's a continuum. That you have someone that may have factors fairly easily mitigated through either interventions, acupuncture, or Chinese herbs, all the way to the other end of complete sterility. What's really unfortunate is, though, despite the greater awareness and with acupuncture, the long history of treating infertility, that only 50% or less of couples actually seek medical advice. However, the good news is 2 out of 3 couples use some form of complementary therapy instead of or along with orthodox medical treatment. And out of those people, about 23% use acupuncture as a part of their treatment. Within the theory of traditional Chinese medicine, creating and maintaining balance is vital in treating people. The factors that I'll review today are internal causes of infertility and also miscellaneous causes of infertility. There's actually a third set of factors recognized that are external factors, they're also referred to as external pathogenic factors. We don't tend to see those as much in practice. They refer to the effect of climate and weather. Most of us lives in homes that are well insulated. Many places have air conditioning in the summer and heat in the winter. So those won't have the same impact as they did 2,000 years ago. We're going to start by looking at internal causes of diseases. Essentially, they all stem from excessive emotions, and those excessive emotions lead to either an imbalance of qi. Qi vacuity refers to not enough qi, impaired blood circulation, dysfunction of zangfu organs, and then an imbalance of yin and yang. When blood is referred to in traditional Chinese medicine, it refers to the functional and energetic substance, if you will, that is the yin as opposed to qi, which is considered to be the yang equivalent. Zangfu organs refers to the functional and energetic labels of organs. Both traditional Chinese medicine and Western medicine use many of the same labels. However, Western medicine is focused on structure as well as the pharmacological and chemical aspects of those organs, as opposed to traditional Chinese medicine, which refers to more and focuses on the functional and energetic aspects. There are 5 emotions that are considered to be pathological, especially when in excess, or if occur if they're not anticipated. You have anger, contemplation or worry, sadness and grief, fear and shock. I'll go over and review each of these individually. The first one is anger. Anger includes frustrations of feelings of frustration and irritation. Anger makes qi rise upwards and is often associated with an imbalance of the liver. This imbalance can have an effect on the menstrual cycle and subsequently infertility. The next emotion is contemplation or worry. Worry in traditional Chinese medicine is believed to damage the heart. It leads to stagnation of qi, which affects the functions of the lungs, spleen, and heart in traditional Chinese medicine. And when there is not enough qi, it also can lead to internal dampness, which subsequently leads to subfertility. The next emotion we're going to talk about is anxiety. Anxiety in traditional Chinese medicine affects the functions of the spleen, kidney, and heart. And also when the functions of the spleen are not able to provide the functions of mostly transforming and transporting qi, it leads to a vacuity of blood, which impacts infertility. The really tricky thing about anxiety is that there's a variety of other symptoms that a person may either present with and say they aren't anxious, or they may inform the licensed acupuncturist that they're anxious, and they have a whole host of other symptoms as well. Fear is also another emotion that many couples experience, especially when they've gone through multiple rounds of IVF, not knowing the unknown especially. Fear has an effect on the kidneys in traditional Chinese medicine, which can lead to an imbalance of yin in the body. It also affects a person's shen, or spirit. Sadness and grief affects the lungs, liver, and heart in traditional Chinese medicine, and also affects the relationship and the balance among these organs. What's interesting is an imbalance of heart qi can also lead to sadness or predispose someone to it. Sadness often affects the channels linked to the womb and subsequently causes subfertility. And it also leads to a lack of energy. Again, many couples that go through infertility treatment have gone through multiple rounds and experience a feeling of disappointment, being disappointed and sad. And they often grieve for what could have been and what they don't have. Guilt is the next emotion that has an effect on internal causes. Many times, subfertile partners will feel guilty for things they felt that they have or have not done in the past, or perceive that they're at fault for what has led to their circumstances. The relationship among the emotions and body and spirit are really, really important. If people experience those emotions either in excess, or if there's a shock, let's say a traumatic event that happens in their life, and they experience one of those, oftentimes the spirit is affected. The Zangfu organs in traditional Chinese medicine are vital for producing qi and are also responsible for the different emotions. Also, physical pathology can, that imbalance from the pathology can also lead to an emotional imbalance. Really good example, if you think about someone who's had a significant or life-threatening diagnosis, the emotions they go through. Kidneys in traditional Chinese medicine store jing, or essence, and when that essence is injured through emotions, reproductive qi is affected, and again, sets them up for a predisposition for subfertility. Treating people's emotions during assistive reproductive technologies or IVF are really, really important. As a licensed acupuncturist, what I do is try and figure out what emotions they've experienced prior to receiving a diagnosis of subfertility or infertility, and then also discern what they've experienced since then. People who have emotions and internal causes of imbalances tend to have a greater effect at a deeper level, and it's important to treat those imbalances. Emotional feelings they experience during IVF and ART treatments oftentimes don't have the same impact unless they've gone through multiple rounds over a long period of time. The next cause of disease and subfertility is what's referred to as miscellaneous causes. These are all the things that can occur in our environment or either to us. The first one, weak constitution. I'll run through these things. I'll back up. Weak constitution is something that many are born with. Lifestyle habits and nutrition are often as a result of our busy and hurried lives. Surgery can have an impact, as well as physical exertion and too much work and not enough rest. Previous fertility treatments can also have an impact. Women with especially multiple miscarriages, what's referred to as inappropriate family planning, or couples who may not have knowledge of when the best time to conceive and timing it with the menstrual cycle, and also the long-term use of contraception. Again, I'll go through each of these individually. First one, a weak constitution. Our constitutions are received from our parents, and things that affect a patient's constitution are the age of the parents and their health, also the parents' emotional state and health, especially at time of conception, and then the patient's gestational age at birth. Also, if there was a traumatic birth as well. The weak constitution is often addressed with acupuncture and moxibustion. Chinese herbal medicine is also used. Lifestyle changes and dietary improvements and regular exercise are really, really important. It's the idea that we focus on things we have control over. Most patients have a predilection towards certain imbalances and have to be mindful of those, especially when being treated for subfertility. Treatments are oftentimes personalized for those individuals that have those constitutional imbalances. Inappropriate diet. Unfortunately, in our society, it's easier to eat lousy than well. Either regular eating or eating too much can have an effect of the functions of the spleen and also lead to patterns of acuity. Traditional Chinese medicine also considers a diet to be in excess when foods that are considered to be too hot, too cold, excessive consumption of raw foods, or eating too much as well. What's really interesting is another aspect of an inappropriate diet is people who are vegetarians. It is, while overall eating a vegetarian diet is very healthy, within traditional Chinese medicine, some of those patients tend to have a vacuity of blood, and that's often corrected with acupuncture or Chinese herbs. Dieting, especially yo-yo dieting, can have an effect on both stomach qi and the acuity of Jing, and also affecting Shen, especially yo-yo dieting, that back and forth. Eating greasy or fried foods can affect the functions of the spleen, lead to dampness and phlegm. And again, all those can eventually lead to subfertility. Exertion can either lead to stagnation or vacuity. Excessive exercise may injure the spleen, liver, or kidneys in traditional Chinese medicine. A really good example would be long distance runners, women who are long distance runners who stop menstruating when they run, especially when they're running a lot of miles. Overwork, coupled with inadequate rest, is another cause. Overwork consumes qi and also disperses yang qi. And then working long hours while not getting enough rest can affect the functions of the kidney, liver, and heart in traditional Chinese medicines. When you look at occupations that are physically demanding, it can also affect the functions of the kidneys in Chinese medicine. Other factors with overworking and inadequate rest, sitting for long periods can have an effect on the functions of the lung and spleen in Chinese medicine. Work environments that are characterized by either mistreatment, intimidation, or pressure to perform can also affect the functions of the liver in traditional Chinese medicine. Liver qi stagnation and spleen qi vacuity is the number one traditional Chinese medical diagnosis in anxiety and depression, and along with secondarily spleen and heart dual vacuity. People who overworked, and as well as having to communicate constantly, think email, cell phones, text messaging, as well as not getting enough sleep, can affect the functions of the liver and heart in Chinese medicine. As I've mentioned, many couples unfortunately have gone through more than one round of IVF or assistive reproductive technologies in an attempt to get pregnant. Those multiple attempts can affect the yin, yang, qi, and blood in the body. It also may lead to heat and stagnation. That heat and stagnation oftentimes comes from the medications to help increase the number of eggs and follicles. And also the Shen is disturbed from failed treatment. It's that anxiety, guilt that I referred to previously. Miscarriages, especially when for women who have had several, oftentimes they will occur in a background of pre-existing either qi or blood vacuity. It is believed that having a miscarriage is as draining as an actual childbirth. Miscarriages affect the functions of the kidney, heart, and liver in Chinese medicine. May also lead to kidney qi vacuity, blood vacuity, and or stagnation. The emotional impact of miscarriages can affect the heart of in traditional Chinese medicine as well. Family planning is really, really important. As couples are attempting to become pregnant, either excessive or infrequent sex may affect Jing, as well as lead to stirring of ministerial fire. Couples who use a rigid approach to family planning may also lead to an imbalance of the liver, specifically with liver qi stagnation. Long-term use of hormonal contraception may lead to either blood vacuity or stasis, as well as dampness. And also this long-term use may also exacerbate other patterns of disharmony the person may be experiencing. The good news is couples who seek treatment are often one of the most motivated groups of patients to treat. I really enjoy treating men and women for infertility and subfertility. These are some variables that affect fertility. We're going to talk about maternal and paternal weight, the effects of smoking, alcohol, and caffeine, recreational drugs, and medication. First of all, maternal weight. 12% of all infertility cases are as a result of the woman being either under or overweight. Women who are considered to be underweight have a a body mass index or BMI of 19 kilograms per meter squared or less. Research has demonstrated they actually have lower implantation rates as well as lower pregnancy rates. On the other side, women who have a BMI greater than 25 also experience lower live birth rates and also higher miscarriages rates. Maternal weight, there isn't really a lot of research that demonstrates men who have a BMI less than 19 have an adverse effect. However, men who are considered to be overweight do have an increased risk of either having a low sperm concentration or essentially no sperm. Increased paternal BMI has been linked to higher pregnancy loss, interestingly enough. Recommendations for men who attempt to lose weight during ART while undergoing IVF. This is actually when they take sperm and then inject it, actually had lower success rates. So the recommendation is if men have a BMI greater than 25 to lose that excess weight before engaging in IVF with their partner. Regular exercise as well as watching what they eat when they eat really, really important. Smoking has a significant effect on all stages of the fertility process. Men have poor semen parameters. Couples who smoke have to go through twice as many IVF cycles as non-smokers. For women who have partners who smoke, it's important to know that secondhand smoke does have an effect on female fertility. The risk of smoking for women, the reproductive lifespan is shortened, as well as it increases the risk for ectopic pregnancies and miscarriages. TCM has its own perspective on smoking. Smoking has an effect on the functions of the lung and the heart in Chinese medicine, also affects Jing. These two things can lead to heat, which consumes yin. Again, back to that yin-yang balance. Looking at alcohol, TCM considers traditional Chinese medicine considers alcohol to be pungent, sweet, and hot in nature, may also induce heat or fire, has an effect on Jing, as well as the functions of stomach and liver in Chinese medicine. Recommendations within traditional Chinese medicine is to limit alcohol intake while going through IVF. It's okay to have like a small glass of wine with food, alcohol with meals. Drink slowly. Many things are best enjoyed while taking your time. And then last but not least, avoiding intercourse when you've drunk too much. Caffeine, a lot of people love their coffee. With that being said, if women who have less than 6 servings a day should not have any problems. However, if they have more than 6 cups of coffee, it may take longer for them to conceive. Too much caffeine also has an effect on success rates of IVF treatment. Right, wrong, or indifferent, caffeine intake does not affect to appear men's fertility. Recreational drug use. This is another reason just to say no. It affects the risk of infertility by 70% in both men and women. Within traditional Chinese medicine, beliefs to deplete Qing. Medications. Medications have an effect on infertility. The FDA recently came out with a warning on non-steroidal anti-inflammatories. They're especially concerned about ibuprofen being associated with increased risk of miscarriage. Also, the recommendation is not to use NSAIDs after 20 weeks because of a greater risk of having low amniotic fluid levels that may lead to rare kidney problems in fetuses. Other medications may affect libido, may increase men to experiencing erectile dysfunction or affecting sperm motility. They also may affect implantation or tubal function. What I recommend to patients I'm treating, if I feel their medications may be affecting their fertility, is to follow up with their prescribing provider to have their medications reviewed or with their pharmacist. Acupuncture has a significant role in the treatment of fertility. Ideally, patients should undergo treatment 3 to 4 months before going through IVF. Using acupuncture alone the recommendation is to be treated 2 or 3 times a week. If acupuncture is combined with Chinese herbal therapy, they could be treated weekly with acupuncture. Acupuncture has an effect on mitigating the side effects of hormones and medications used. The gonadotropin releasing hormone, GRH, can cause a lot of discomfort, and I've been able to mitigate a lot of those effects. Also, acupuncture helps support the patient psychologically and emotionally, as well as addressing underlying traditional Chinese medical imbalances. Acupuncture has an effect on stimulating the follicle-stimulating hormone, as well as the luteinizing hormones. Has an effect on the menstrual cycle in terms of regulating it to make sure that ovarian stimulation is started at the time during a regular cycle. It also can help with the follicular recruitment in the late luteal phase as well. These are the 2 treatments I will often use in helping women prepare. The first one is referred to as a balancing treatment, and then the second one is what you see of a more traditional Chinese medical treatment. The point shown in the picture is Yin Tong, very effective for nourishing yin, helping people sleep, as well as relaxing. Acupuncture, when done during the ovarian stimulation phase, has an effect of increasing the total number of retrieved eggs, as well as increasing the number of high-quality eggs retrieved. It also can help thicken the endometrial lining as well. This is one protocol that's used for acupuncture during this time. Yin Tong, which is in the previous picture. Gong Sun is a point in the foot. Nei Gong is pericardium 6, also very effective for treating morning sickness. So Gong Shui, Guan Yuan, points in the abdomen. Su San Li, San Yin Jiao, very effective points both on the leg. During the final phase of egg maturation and ovulation, this is a point prescription I'll often use. Again, many of the same points, Gong Sun, Nei Gong, Guan Yuan. Oftentimes I'll use acupuncture with electrical stimulation. So Gong Shui, which is a point on the lower abdomen, with either Gui Lai or San Yin Jiao, those are points on the leg, or further down on the abdomen. Gui Lai is further on the abdomen, San Yin Jiao on the leg. Very, very effective. Shui Hai, it's a point on the inner part just above the knee. Su San Li again. For embryo transfer, there are a number of protocols used. This is one I like. This protocol is done as soon as 25 minutes after transfer and up to 5 days of the embryo transfer. Ba Hui, the point on top of the head. Guan Yuan again. Qi Hai, Fu Liu, Su San Li. All very good points. During the 2-week period, what's referred to in Western medicine as the 2-week wait. This is where, from the time of transfer to when the woman will have a pregnancy test to see if the IVF process has taken. Emotional support is incredibly important during this time. Women go through all kinds of emotions. If I'm pregnant, what does this mean? Again, many have gone through multiple rounds. If they're not, what does that mean? Do they keep trying? It can be just quite a roller coaster ride. This is an acupuncture protocol that I'll often use. Guan Yuan, again, point of abdomen. Qi Hai, just below the belly button. Gui Lai, Nei Guan, all very good points. The therapeutic relationship between a licensed acupuncturist and patient is really neat. Acupuncturists as providers are one of the few that spend as much time as we do with our patients. Treatments go anywhere between 45 minutes and an hour. The initial evaluation, at least 45. what's really nice about the acupuncture, it has an effect of unifying both the body, mind, emotions, and spirit. The process of acupuncture helps the patient be in a better space, both mentally, psychologically, and physiologically as they go through the ART or IVF process. What's really interesting is when people have acupuncture with a licensed acupuncturist and develop that relationship, many patients will have a greater sense of control over their fertility issues in different aspects of their life. And that is all I have today. I'll let Kim see if there's any questions on the chat.
There are no questions. I do have well, I suppose there is a question because I have a question.
Sure.
Do you often recommend that people but do meditation to come? It just seems like it's such a huge mental load, and you need to kind of calm yourself as much as possible and take out the stress aspects of your life. I'm assuming that would be a part as well.
Excellent point, Kim. And, I tried to keep it as close to the hour. I do. What I do is I get a sense for the person. If I get the sense that the person is amenable, I'll recommend it. I'll start with an app, either the Headspace for iPhones or Insight Timer. If there's someone who's more interested in a more traditional form, a meditation may have them focus on their breathing when we're especially doing the acupuncture, and then let them know this is something they can do for brief periods of time during the day as well. If it's someone who's not, what I would say, overtly open, I encourage them to focus on activities they enjoy doing. I think of John Kabat-Zinn's raising exercise on mindfulness meditation that he's done for many years. But find what they enjoy doing and then have them focus on being mindful in doing those things. Excellent question.
Okay, that sounds great. If you are watching this on YouTube, feel free to email Dawn with any questions that you might have following the presentation. Post them in the comments, whatever you would like to do. And we look forward to having Dawn again to have another webinar on how acupuncture and Chinese medicine can encourage health in so many different aspects of your life, in addition to infertility. And it's been great having you, Dawn.
All right, thank you, Kim. Thank you for having me.
And yeah, we'll see you again.
All right, thank you. Have a good day.
Thanks for tuning in, everybody.